is a very interesting topic today, and everybody we need to understand, and I need to be implemented. Not only the sick community or the diabetes people who are suffering, non-diabetes patient also who are upcoming diabetes condition, we also avoid and take care of our health. That will be really good, so that we can do the prevention as well for the today's topic. Now, in the pancreas is the main reason to cause the problem number 1. In the pancreas is the organ. Where is it located? On the just distal to the liver, and then crossing to the duodenum, and then proximal to the anterior to the spleen. This pancreas is located, is a very small organ, not very big organ. But in that organ, there are the one particular or 1 gram. 1 gram in the pancreas is existing. In that, it produces the hormones. The entire pancreas is there. In that pancreas, very micropod. Very micropod having the place where the hormones will release. One hormone to be known as a insulin. The second hormone to be known as a glucagon. Glucagon, glucagon. Two types of the cells are existing. One is the alpha cells in the pancreas. The second cell to be known as a beta cells of the pancreas. Beta cell of the longer horns of the pancreas. Alpha cells produces one hormone, then glucagon produces the another hormone. So alpha cells produces the hormone called as a glucagon, then the beta cells produces the hormone called as a insulin. But both the hormones are very much essential to the body. At the same time, it is indispensable to each other. It is opposite to each other. But fighting, frightening. That means is the yin and yang. So insulin is the yin, glucagon is yang nature. So yin is supporting to the body system to minimize the sugar level in the body. Glucagon is against to that, it increasing the insulin, it increasing the sugar level in the blood. Two opposite reactions. But both are required each other. But it shouldn't go to the lower direction. That means it is, what is the normal range of the diabetes mellitus? Fasting is how much and PPBS is how much? Good.
Fasting 90, 140.
Yes, fasting is 100 to even 110, 120 to be considered as a normal. If the postprandial maximum is 170 till 180 to be considered as a normal. So the diabetes sugar shouldn't go downwards direction. That controls the glucagon, right? When the diabetes shouldn't go to the upward direction, that controls the insulin in our human being normally in our body system, where the patient doesn't have the diabetes mellitus disease. But normally sugar, which we called as a inside the blood vessels. For example, whatever we eat, we require the food for the survival. That time we take the food. So that time we take around 200 calories or 500 calories at a time. We consume the food. So that will be converting in the form of the chi, in the form of the energy. if that will convert in the form of the energy, that will be the good amount of the glucose which is required to our body system. When we have the more food, for example, we require 2000 calories in a day, but we consume at 3000 calories. So that generally it convert in the form of the glucose. Then slowly that how much body is required will utilize it. So later that pass on to the liver system. Liver will store the energy in the form of the glycogen, not as a glucose. But glycogen it convert in, it stores, and fat and it stores, right? So this will be adipose tissues will store in the, and proteins and amino acids stored in the liver. Then whenever it is required, that time it provides energy. For example, now we are in the fasting. During the fasting, everybody we feel hungry, but still we don't want to take it. But we can manage. But how can we manage that? How I can address you? With the support of the liver energy, glycogen which is stored in my liver, that will convert in the form of the chi, that is called as a glucose, right? To break down of the glycogen to the glucose, so that we are talking, we are listening, we are active, we are doing the job, so on. So in this way this will going to work. When the beta cells is required, when is required to regulate and monitor, this is beta cells, insulin production is there. Insulin production is very less. At how much is required, that much it releases in the blood. When it goes higher level, that also dangerous. It goes hypo level, that also dangerous. But normally it is required. How the modern medicine has been fixed, that is so and so is required, 100 to 120, but it is 90 to 100 is normal according to the modern medicine. But according to the previously, according to the British Medical Journal, it is 120 approximately is normal, which on those time they addressed it that even 170, 180, 190, when I was studying in 2000, in 1998 I believe, on 2000, so that time it shows it is 2200, 190 could be the normal. So now slowly that appearing to the, I am really worry about that 130, some laboratories showing is the postprandial is normal. But cannot be considered that it is the body is giving us the good alarm, you are good active and you can do your performance well, then it is 160 is there, totally cannot be considered as a diabetes. Now off late is the pre-diabetes also they were mentioning. Of course, pre-diabetes you are stepping into the diabetes very soon. Perhaps after 1 month, 3 months or 1 year or 2 years later, you are stepping into that. But make sure that you will get the alertness. But now what I mean to say, from now onwards we should get the alertness. What is wrong in that? Is not that welcoming to the diabetes. So you are in the perfect mode that I want it to be my systematic, my rule is there, what to be taken, what not to be taken. Of course everybody should follow. So however the insulin is required, the minimum quantity of the insulin whatever adequately required, that's producing in our body who are the non-diabetes. Who are into the diabetes, the production level is lesser than the normal what is required. When the lesser to be normal, that to be considered as a type 2 diabetes mellitus. Right? When there is no insulin production at all, no insulin production, that means is the beta cells of the pancreas are dummy. That means inside the blood vessels, but there is no production at all, then that to be considered as a is the zero insulin production by the pancreas. That condition may require like a artificial insulin is required. Now insulin also two types. One is the short acting insulin, the other one is the long acting insulin. Now the diabetologist will recommend take the two insulins at a time. However, it is left to them what to be given, what not to be given. But why you wanted to take up to that serious level to take up the insulin? When we understand these two concepts, for example, one diabetes patient is coming to you. That time you are treating to him. So there is the postprandial is 350 or 400 or less than 300, the patient is not at all coming out. So that condition, certainly the body will not responding to the treatment. Perhaps insulin is not producing enough and there is no production at all. That time it is advisable to mention them. Better you can proceed for the various treatments, but still body is not responding, then advisable to go for the insulin. When less than 300, it's not at all coming to the patient. That time body it gives the resistance to the treatment, either acupuncture or the naturopathy or some other Ayurveda or homeopathy or Unani system or the tribal medicine or the Tibetan medicine or homeopathy medicine. The medicine is not supporting for him. So that time what is required for them, there is no option. Ultimately they go for the insulin production. When the insulin, yes, administration, that to be given as a subcutaneous level on the hand or on the abdomen or on the thigh region, anywhere can be given, right? Self use can be taken place, but that without that is the type 2 diabetes mellitus, which you can manage that. Of course, the patient is on medication. You also provide them treatment for them. The patient is smoothly going without any maximum sign and symptoms. Then certainly you just take to that level itself. If the patient is not at all responding with the medicine, then or the treatment or acupuncture treatment or some other treatment, better we ask them to visit to the diabetologist, because the damaging will be taken place to the internal organ is slow and steady, but don't damage drastically, because the major complication of the diabetes mellitus, sometimes it causes the retinopathy, it causes the neuropathy, it causes the nephropathy, right? So the cells will going to damage. How will going to damage all these things? Because inside the blood vessels there is the insulin, it goes, insulin it's kind of the chi or the energy. When the neuropathic condition, for example, numbness is there, tingling sensation is there, on the lower burning sensation is there, that condition where the nerve endings having the problem, where the blood supply is not reaching to that particular part of the terminal of the region. So that time where the glucose inside, the excess glucose is there, to control that insulin is very poor. So that reason certainly having the impacted that, where there is the impairment of the organ, impairment of the skin, impairment of the eye, impairment of the kidneys, etc. Right? So that's the reason we shouldn't go to that level, that patient sending in the last moment. Better you can send them in the beginning itself if the body is not responding. But however, this is in the later stage. What the best can possible to do through our treatment, that we will look into that. Certainly we will understand. Now diabetes is the chronic disease, not as an acute disease, that occurs either when the pancreas does not produce enough insulin, when the body cannot effectively use the insulin it produces. When the body cannot effectively use the insulin, that means there is no insulin, the production is not there, then we cannot use it. Insulin is the hormone that regulates the blood glucose all the time. Hyperglycemia means excessive blood sugar. The blood is excessiveness. When you wanted to write down in the modern medicine, you just write down hyperglycemia of the patient or the non-insulin dependent diabetes mellitus. Non-insulin, NI dependent, NIDDM. That means is non-insulin dependent diabetes mellitus. You write down in the short form NIDDM, that would be better. The type 1 diabetes to be known as a insulin dependent diabetes mellitus. Insulin IDDM, that to be considered as a insulin dependent. Right, that's called as a type 1 diabetes mellitus. Now otherwise you can write down hyperglycemia. When the sugar level it goes 250 above, then you can mention hyperglycemia patient. Also called as a rise in the blood glucose, or rise in the blood sugar is the common effect of the uncontrolled diabetes. over time leads to the serious damage to the many of the body systems, especially on the nerves and then blood vessels. Is it also affecting the animals as well? Animal diabetes also affecting? Yes. Diabetes mellitus occurs due to an animal inability to produce enough insulin or use it properly. Insulin is the hormone that effectively breaks down the sugars, fats, proteins, including the sugar glucose. Without insulin managing glucose levels, sugar accumulates in the blood, spills out into the urine, and can result into the serious health conditions. Pets with diabetes should be evaluated by the veterinarian every 2 or 4 months and also health issue. So owners should also watch the changes in the pet's behavior. Normally for the veterinary doctors, they also treating for the pets also these days, how the modern medicine, how we are eating. Likewise the modern pet shops are there, is the organic shops, is the food shops, and cloth and costume shops are there for the pet. Even there they wanted to buy it, so which also having some chemicals as well, but these days has been developing for the dogs and then cats as well. So there were even horse, so elephant, all the wild animals, of course, which is existing on the forest. Perhaps they don't have much because they are taking the all the organic food stuff. Whereas in these pets which at homes, they too have the problem is related to the diabetes mellitus. But what I told you, there is the certain medications, certain treatments can be given to them. Even for them also it is advisable what kind of the acupuncture treatment to be given to the human system. Same meridian system is existing with the animals too. So where the pancreas are there, how the spleen meridian is existing on the toes, but same toe, the spleen meridian and pancreas meridian is existing to the toes with as well. But this to be considered as a arms and this to be considered as a legs. What? So normally we can consider back side is legs and the front side is to be known as a hands. But where is the spleen meridian starts on the nail base of the toe, there itself for the nail base, they too having the meridian system. Animals also meridian system. That's the reason animal acupuncture also existing today. If wanted to learn this also, the people who are normally we do the deal with the patients who can speak to us, but this animal doesn't speak. You wanted to become, even veterinary doctor is really good doctor than the animal doctor, because they are doing the good service to the society and for the especially for the pet and dogs and animals. That's one way is good. So here is they also, even Dr. Anjani Kumar, so who studied acupuncture with us, who is the Bachelor of Veterinary Science, BVSC. BVSC is the Bachelor of Veterinary Science, is the qualified doctors, where the veterinary council is there in Bengaluru, where is the veterinary college is there here, where the agricultural institute of the technology. So in that inside veterinary council is there. In that council they do the registration after completion the course. So after that the Dr. Anjani Kumar wanted interested to learn here, and then he studied acupuncture. He is implementing for the animal also as a acupuncture. I am really proud and happy to say this moment. So he is treating for this condition as well.